Live from New York, it's Benefits with Friends. I am your host, Lou Bernardi. Thank you for joining us today. We took a little bit of a hiatus during the summer. We have a great show and a great guest for you today. Let me bring Marshall Allen into the podcast. How are you, Marshall?
I'm doing great. Great to see you, Lou.
Awesome. Yeah, I love the shirt. So you are my second two-time guests on Benefits with Friends, and
Honored.
when you and I chatted last, we talked a lot about your book, the Never Pay where is it? Never Pay the First Bill book, which I will grab and bring into the show. So if you don't have this book, I recommend highly that you go out and purchase it. Amazon, maybe on your website too.
Yep.
Allen Health Academy. But today, we spoke recently, and I'm a real big supporter of yours. I'm really trying to draw some attention to the great work that you've been doing and hard work that you've been doing, putting an educational video platform together to really help the American healthcare consumer. And we talked a second or two before the show about a particular situation that one of our members finds themselves in. But I wanted you to reintroduce yourself to the audience, a little bit about you, a little bit about the Never Pay pathway that we're going to talk about today.
Yeah, thanks so much, Lou. I really appreciate you having me here. So I've been on a campaign, a quest, a journey to make it a goal to educate employers and working Americans about all the ways the healthcare system is taking advantage of them financially, and then most importantly, what they can do about it. And so I spent 17 years as an investigative journalist covering healthcare. I still consider myself a journalist, although that's not my full-time day job now. The most recent 10 years, I was at ProPublica doing investigative reporting there. And so I've written hundreds of stories about patients, everyday people, just getting screwed by the healthcare system. And your audience knows this, but the financial side of the healthcare system in the United States is preying on employers and working Americans. They really are. It really is a system that is designed to exploit sickness for profit. And so in my book, Never Pay the First Bill, so I wrote all these stories as an investigative reporter. That led me to write Never Pay the First Bill. And what's been so satisfying about Never Pay the First Bill is, especially I encourage people to go on Amazon and read the reviews. A woman just posted a review yesterday about how she saved $21,000 on a surgery that had been wrongly coded on the bill. She read my book. The book shows how to analyze and understand your medical bill, how to get an itemized bill with the billing codes, how to check to make sure that the itemized bill is accurate, how to make sure the bills are fairly priced for each code. It warns people about things like upcoding, which are, an epidemic in healthcare. And, people then learn how to look at their bills, how to push back, how to contest them. They also learn I write about hospital financial assistance policies, which many people do not even know exist and can completely forgive bills. Or what do you do when your insurance company denies payment? I have a chapter about that. What do you do if you have medical debt in collections, as unfortunately about 100 million Americans do? So the book covers that. So it's really, I heard someone describe it as the art of war for healthcare. That's what the book is. And what I love is that the book has proven the concept. We have shown that at least when the patient is ready to learn, they will knock down walls to fight for what's right and to stand up for what's right. I even have a chapter in the book about how to sue in small claims court to defend yourself. It's extremely effective, and I help people do that all the time. So I always encourage people, reach out to me if you need help. I'm always available at marshallallen.com. People can message me, and I'm getting messages every day from people who I'm helping, people who are having victories, and then I write those up in my newsletter. So we've proven the concept, Lou. People think that employees can't learn to navigate the healthcare system. They can. They actually can. Writing the book then led me to launch Allen Health Academy. Allen Health Academy is a company that's a health literacy company. And I like to tell people that healthcare literacy is financial literacy. So we have a lot of talk about financial literacy, how to invest your money, how to manage your money, how to look at your checkbook or your, statements from your credit card companies, make sure you're not getting ripped off. So there's all these tactics about financial literacy, but what people don't really talk about is the amount of money that you can lose is exponentially higher than some hidden fees on your bank account or something like that when you talk about healthcare costs. I like to tell people, and I think it's true, you can save hundreds or even thousands of dollars per healthcare encounter if you know how to navigate the healthcare system, if you know about price variation and can get a better price on a medical service you need, an image you need, a lab test you need, a drug you need. So that also then led me to create a series of health literacy videos. And the videos are called the Never Pay Pathway. And this is a video curriculum that is designed for behavior change. Okay, we don't need people just to understand a few tips and tactics. We need people to reframe the way they engage with the healthcare system. And I'm talking about employers and I'm talking about the employees. And so the videos, it's a curriculum of 15 videos, actually 16 videos. They're about 5 minutes each. So it's about an hour and 15 minutes of content. Those are found at allenhealthacademy.com. And individuals can subscribe. Employers can subscribe. If people are interested in licensing the videos, we can do it that way. So what I'm really looking for, Lou, is employers that get it and organizations that get it and understand, hey, we value educating our employees. We're giving them this blank check to go out and spend our employers' money on healthcare. But what are we doing to equip them and to train them so that they can navigate the system? So I'm really proud also that video curriculum, the Never Pay Pathway, has been approved for continuing education credit through NABIP, which is the National Association of Benefits and Insurance Professionals. So that's the big broker association.
Right.
So now brokers can watch the videos and get continuing education credit. And it's been approved for continuing education credit through SHRM, which is the big association for all the HR people. So now HR people can watch the videos, complete some assessments, get continuing education credit as they get educated to navigate the healthcare system. And so what I'm seeing, Lou, is that the HR people need to be educated, the brokers need to be educated, the employers need to be educated, and the employees need to be educated. And so the Never Pay Pathway videos really bring the education to scale. In a way that the book doesn't. So maybe people like the book, maybe people like the videos. I'm also in the process of creating a chat bot that I think is going to be effective to help walk people through the various strategies and tactics. So I'm developing new products. So anyway, I'm having a great time doing it. But it's an immense challenge, Lou. I mean, I'm not going to lie, it's a challenge because people don't really feel motivated to learn about how to navigate the healthcare system. And I get that. I totally understand it because it feels overwhelming. It feels too complicated. We've been conditioned. We've been groomed, Lou.
Groomed. That's my word too.
That's the word I've heard you use. I've used that word too.
Groomed.
We have been groomed to be passive. We've been groomed to trust that the healthcare system is looking out for our best interests. And what you and I know and others have discovered too is that we should not trust the financial side of the healthcare system to be looking out for our best interests.
No, it's, in many ways, it's like preventative care, right?
Yeah.
If you would avoid it, you have a really good chance of running into something much more significant later on. And if you don't take the time to understand your rights, understand the healthcare ecosystem, the health insurance ecosystem, your rights as a patient, the fact that all of these transparency regulations and laws that were passed, but it's not getting to the end user enough, right? And because we've been groomed, a lot of times people just have thrown in the towel, including businesses. I love what you said about this unlimited credit card that employers are giving to their employees, because it's the company's money that they're spending, and they could spend it so much more wisely. And then think of the savings. I mean, the health plans that we've built, our experience so far has been a savings of about 30%
Yes.
on the medical claims, 50% on the RX claims. That's money that, whether you're a fully insured employer, you're self-insured employer, you're retaining that money, right?
That's right.
You no longer have that waste within your plan. And if you can make your employees, which are your little army of healthcare, purchasers for a business, if you can help them to do it smarter and incentivize them to do it, wow, that company can thrive. The people can thrive. You
Yes.
can reinvest that waste. You mentioned something like upcoding. Most people wouldn't even understand what upcoding is, but it's so prevalent in healthcare. And essentially what that means is that, doctors, hospitals, facilities get paid more when they put different modifiers on a claim to make it look like they did more work than they actually did. They spent more
Right.
time with the patient. It was more serious. Emergency room visits are very popular for doing this, throwing things in there. You go in for a Band-Aid, or you walk out with a Band-Aid, but it's as if they did major surgery on
Right.
you. And because no one's looking, no one's got their eyes on the wheel or hands
Right.
on the wheel, eyes on the road, hands on the wheel. It's early. No one is watching out for this spend. So it's so easy for the healthcare system and, the insurance companies, they're not doing their part to help, control the, you think about the way credit cards work. I mentioned just before we jumped on the call today, I'm a victim of credit card fraud this morning. Someone got my credit card. They bought a PlayStation on Costco. Luckily, there's a speed bump. I got an email. I got a notification. I get a notification every time someone uses my Amex card. Why shouldn't insurance companies be doing the same thing? Before we pay this bill, was this actually done? Here's a text message. This describes the service that was rendered on this claim that we received from this physician. Does this sound right from you? I'm
Right.
going to make this suggestion because I haven't heard that before. Hit yes or hit no. No, did you have this done?
Yes.
No. And say, this means this. Here's an explanation of what that code is. Why couldn't insurance companies actually do that? Let's work on that. I want to work on that together with you.
That's a great point, Lou. The insurance companies do not have the incentive to protect the
No.
money because it's not actually their money. It's not actually their money. In most cases, it's a self-funded employer.
Right.
They're literally just the administrator that's paying the claims, but it's not their money. It's coming out of the employer's coffers. And in a fully insured plan, they're a middleman that takes a cut of the percentage of the total.
Yeah.
Typically about 15%.
Yeah.
Well, they need actually for that total to expand year after year after year so that their 15% cut results in an increased amount of revenue every year.
Sure.
So they do not invest a lot in fraud enforcement. Your idea is a great one. They could they could absolutely put that technology in place if it was something that they cared about.
Right.
But I encourage employers. I have 3 chapters in my book that are devoted to employers, and one of those is about fraud and just some incredibly absurd cases that really show just how little the big insurance companies care about policing fraud. I've talked to more than a dozen fraud investigators that work for the big insurers, and they will tell you they can identify fraud all day long, but when they take it up to the general counsel for their insurance company, the insurance company sides with the doctor or sides with the hospital because they want to keep them in their networks. So the loyalty of the insurance companies is not to their members. The loyalty is to the doctors and the hospitals that are in their network so that they can say, well, we have a broad network. All these people are in network. They don't want to crack down on these things. And so the employers need to be engaged. And that starts at the front lines with the employees. There's no one who's more aware and able to verify whether something happened or the degree to which it happened than the patient themselves.
Right.
They can check that. And that's what I show people how to do for themselves in my videos and in my book, how to check things, how to get that itemized bill, how to check it and make sure that everything occurred. In many cases, that's by obtaining your medical records, which is really easy to do and which everyone has a right to get. You can check your medical records and say, the medical records, do they show the amount of time that the doctor spent with the patient? Do they show that all of these different services were administered? because the medical records are the best record of what actually happened. The claim
Right.
is then extrapolated from the medical record and can often exaggerate or incorrectly say what happened during that visit. So anyway, it's the exciting thing though, Lou, is what you and other advisors and employers are doing. This is winnable. So the subtitle of my book is Never Pay the First Bill and Other Ways to Fight the Healthcare System and Win. The winning is what we're talking about. Employers and employees should be paying a lot less for their health benefits and getting a lot more for their money, but they need to reframe and change their behavior with how they engage with the healthcare system. So that's what I'm showing people how to do.
Yeah, you're empowering people, right? We're trying to, we're trying to fight 30 years of I'll use grooming again.
Yeah.
It's Friday, it's so true, and it's so sad because doctors are not bad people. Most doctors are excellent human beings. They got into this profession, to make a difference. Probably to make a fair living too. I mean, they're, and I still think today, doctors, that profession should be something that is congratulated. That they should be looked at. They've educated themselves. They really have the potential to do such great things for the communities that they serve, but they're pawns in this healthcare system as well.
Yes.
Managed care, it didn't exist when I got in the business in 91. There was no real managed care. It was probably started already, but it hadn't yet came to the Northeast. There were indemnity plans, Guardian, US Life, Home Life, Chubb. Those were the big carriers back in the day. And there was no network. You went to the doctor, the patient went to the doctor. You were responsible for to pay the doctor. But because there was a relationship, most of the time the doctor didn't charge you up front. They understood that, we want you to come back. This shouldn't feel too businessy. It is very personal. You could assign payment to the doctor, or you could get the payment sent to you, and you could pay the doctor. And a lot of times the doctor would say, don't worry about your out-of-pocket cost. Probably people have this relationship with their auto body shops these days. A lot of auto body shops, mine doesn't particularly do this, but they'll waive the $500 or the $1,000 deductible because they make a lot of money and they want a repeat customer. Doctors wanted a repeat customer. Managed care destroyed the patient-doctor relationship. It absolutely destroyed it. All of the different attempts at compensating doctors completely failed. They're completely misaligned with what's in the best interest of the patient now. So that now doctors are forced, because so many of them work for the healthcare system, they're forced to see a patient every 7 minutes, and 5 of those 7 minutes are, my experience, spent with their back to the patient, typing the medical notes, as you mentioned. Got to get those notes in the system, right? This is everything I did. Because if they don't do it then, they spend 4 hours after hours doing it. So are they really even paying attention? How many people can type and listen to, the patient, at the same time? So, my hope is that managed care disappears in the next 5 to 10 years. We don't need managed care. It's completely failed. There are no discounts. If you don't have managed care, you don't have insurance companies that have to have that hospital in their network. They just pay the hospital.
And we are at a really exciting turning point right now, I think, Lou, with the price transparency that has come out now because of the hospital price transparency final rule. The hospitals have been required to disclose their prices for cash prices, Medicare patients, and all of their discounted prices that they give to different insurance plans. And what that is showing, again, I've looked at these across the country, and the variation is ridiculous and inexplicable. You're seeing, a patient covered by Aetna would pay, say, for a colonoscopy. Okay, colonoscopy is a good one to look at because it's a standardized kind of procedure. I think it's also a great metaphor for what's happening to American consumers healthcare right now. So a Medicare price for a colonoscopy might be about $1,200. you would have an Aetna, Cigna, United, those other types of commercial plans. They might pay $2,000, $5,000, even $10,000. On average, the private insurance companies are paying 2 to 3 times the Medicare rate.
Hmm.
But on other items, they're paying 10 times the Medicare
Yeah.
rate, 15 times the
Yeah.
Medicare rate. And this is what this is standard procedure in healthcare, but it's price discrimination against working Americans and employers, because there's no reason that makes sense why a working person should pay 2 to 10 times more than a person who's retired and maybe on Medicare.
Right.
And so in a lot of cases, what you also see is that the cash prices, Lou, are lower than the discounted insurance company
They
rate.
are. They
You
can
see
be.
that all the time. In fact, there's a study. I wrote about this recently in my newsletter, and I also just want to plug my newsletter. It's marshallallen.substack.com. This is a regular health literacy newsletter that I put out. But I wrote recently about cash prices, and I think it's in about half the cases. A group from Johns Hopkins did a study, and they found that the cash prices were lower than the discounted insurance prices. So this myth that we've all been taught, how we've been groomed to believe that we need the big insurance company to get us the best price, is actually a myth that we need to stop believing, because in many cases you can get a better deal with the cash price. So then you start to ask, why am I paying these massive premiums every month? Why do I have this massive deductible if I can't even get the best price when I use my insurance plan? So what we're seeing now that I think is exciting, and I know you and others like you are putting these things into place, is direct contracting.
Yes.
Where, like you mentioned, the doctors and the hospitals, they're on the front lines providing the services. They're not getting all of that money. A lot of that money is going to the insurance companies, the other middlemen in medicine. When you direct contract with a physician group, with an orthopedic group, with an imaging group, with a lab group, you can cut the middleman out of the picture, negotiate a price that's a fair price, that's paid on time, without big disputes, because a lot of times the medical clinicians are not getting paid by the insurance companies. They have to fight for that money. That money gets clawed back from them. They're not happy with the insurance companies.
No.
So we need more employers to engage directly through direct contracting with the frontline clinicians to provide the care that people need. And when they do that, they can bring the price down for the employer and the employee, and they can bring the payment up for the frontline clinicians. So we are seeing a lot of exciting change happening right now, and we just need more people to be educated about it and have the courage to push back. It takes some courage, it takes some engagement, and that's what we need people to do, is wake up, get engaged, get empowered, and move forward.
Well, when you fight back, the fight usually, especially if you take it to court, you mentioned small claims court, and I don't know percentage wise, but I would imagine, when you present the details of what you've been charged versus what because of the transparency laws, what those facilities accept every single day from Medicare, their posted cash prices. And I want to talk about that in a second, but that judge or whoever is making the decision probably would be a judge. It's not going to be anything really, but that is going to side with the patient 99% of the time. I can't imagine that they're going to sit there and say, no, you're entitled to more because you did extra work.
Right, correct. And 99% of the time, Lou, it doesn't go in front of a judge.
Right.
Because think about what happens when a patient sues.
They'll lose money
in small claims court.
Yeah.
That bill might be, hundreds or thousands of dollars. That clinician or that hospital or whoever is being sued, they're going to have to hire an attorney to defend themselves in most cases. Well, the attorney fees are $500 to $1,000 an hour.
Right.
So do you really want to spend $500 to $1,000 an hour to defend a case where you're wrong to begin with?
Yeah.
Second, it's only worth a few $1,000s in most cases.
Yeah.
And so that's why I think small claims court is the most powerful tool for the patient to flip the power dynamic. And what I like to say is give them the incentive they need to do the right thing. They shouldn't have overcharged the patient to begin with.
No.
But the patient needs sometimes to use some leverage of our judicial system through small claims court to to sue or even to threaten to sue. And when they do it with the evidence, again, in my book and my videos, I walk people through each step of how to do this.
Yeah.
Not time consuming and it's not difficult, but you actually have to know what you're doing and then you have to follow up with it, right? It doesn't take a lot of hours, but it takes a lot of time because you have to send that email to get that itemized bill. And I show people, here's how you get an itemized bill. You cite the HIPAA law. HIPAA says we have a right to every single document that they have. Any HIPAA covered entity, insurance company or hospital or doctor or dentist, we have a right to the claim itself. We have a right to our medical records. We have a right to any decision an insurance company makes about our case. We have a right to all that information. You have to know to ask for it. You have to cite the HIPAA law. But trust me, when you cite HIPAA and threaten to file a complaint for a HIPAA violation against a hospital or a doctor, they're going to send you that itemized bill. Again, if you copy the general counsel for the hospital or the compliance officer for the hospital and say, I need this itemized bill, you will get that itemized bill. And if you don't, you file a complaint with the federal government who investigates HIPAA, the Office of Civil Rights. And again, I show how to do this in my book. I show how to do this in my videos. I provide all the links in the videos. So that, and I have a template even that I've drafted that people can use. They can fill in the blanks and use my template to make this request. So again, it takes some time because you have to wait then for that to happen. You have to look up the email addresses. You have to send them the email. But I'm showing people how to do it. They get that information. So you have all the evidence you need before you file your case. So they don't have a leg to stand on, Lou. And so what you see is that after they file a case, when it comes to that, you typically see the hospital attorney reach out to the patient and say, let's settle this. We don't need to go to court. And the case gets taken care of in a way that's fair to the patient. So it's extremely empowering. It's actually really fun too. And so what I'm trying to do is demystify this for people. People feel paralyzed by the complexity. They feel powerless because, again, they've been groomed to think there's nothing they can do about it. But I'm telling you, you and I both know there is a lot people can do, but they got to change. They have to change. And so that's what we're talking about, behavior change.
And not only is there so much you can do, what I love, I know you're familiar with Health Rosetta, so I've been involved with the Health Rosetta, great organization.
In my book.
I've been involved for about 5 years, and every year we go back. We just came back from Chicago. We had the Rosetta Fest, and it's not just advisors. Another word for broker, advisors. I happen to be a benefit optimization officer. People call me Boo, but there's people like yourself. There's doctors, there's clinicians, there's so many different ways to attack this problem. There's a company called Slingshot Bills. Zoe Holderness, who has been a guest on the show, with her partner. They're recent college graduate engineering students. They were working for Microsoft and Google, and they came across this problem, and they're young, smart people that know numbers, and some didn't make any sense. They hadn't seen the cost, and Zoe herself received a bill. She's like, "What is this? Why is this so expensive?" And she started looking into it, and now her company can work. They're doing a lot of different things. She's getting so much more deep into the weeds now, and with her engineering, brilliant Georgia Tech education, she's thinking of just really advanced ways of trying to attack this problem. Yourself, who came from the publishing background, investigative reporter, you mentioned the cash price before, and I just want to go back to an example. We were talking about it before we went live today of how predatory the healthcare system is. And we have a member. I'm not going to go into any specifics about anything, but we have a member who was going for surgery, knew they were using a doctor that wasn't part of their managed care network. So 2 days before the surgery, the physician's office had this member sign a document, signing your life away. I mean, basically your financial, future away. And I have it right here on my desk. I'm not going to show it and everything, but the estimate for this procedure on this mentioned the doctors that were going to be involved, which we verify through the EOBs. These were the doctors that were involved. But the estimated cost of these procedures was $100,160. And
Wow.
there's a little clause there that probably the member didn't even notice. It says details below reflect estimated cost, assuming no insurance coverage would be provided for the services.
Wow.
So essentially, this is the cash price, $100,000. So now we have this account. We're working with a great population health nurse navigator. Nurse Sam is involved with this, a great TPA, PBM. And basically, the bill was $139,000 from one doctor, $139,000 for the second surgeon, $49,000 for the assistant surgeon.
Wow.
Right? So now we're close to $300,000 already. And then the hospital was another $130,000. The hospital was paid in network. That was part of the Cigna network. So the hospital's taken care of, but the doctors are out of network.
Wow.
The TPA, now we know based on Medicare, so we'll talk about the cash price. The estimate was $100,000. When you look at the code that was used on the claim, the Medicare price is about $10,000, $10,000 to $13,000, because there's certain modifiers that they didn't include. And you only pay one surgeon. You can't bill two surgeons, right? Now, maybe there's a modifier for something being bilateral, right? Which in this case it was. So maybe it doubles potentially. They haven't submitted it correctly, so we don't really know yet. The assistant surgeon was paid $970. That was Medicare plus 50%. Billing $49,000. But the assistant, I don't know what the assistant did. I'm sure, brilliant surgeons, all of these doctors were. But here's a member that now is looking at a balance bill of almost $300,000 when the estimate was 100. Signed it 2 days before, and I'm looking into some of the laws because I believe when you ask someone to sign a document like this, I believe you have to give them 2 days notice. But I'm looking into that. I was told that by a university attorney, so I need to look a little bit deeper to see if this signature on this paperwork is even genuine. But this member probably doesn't know about this bill yet because it's been denied by the TPA.
Right.
We know that this person is going back to these doctors again for another surgery.
Wow.
And here's the missed opportunity. And I spoke to Health Rosetta about this. This member who has a lot going on, we know a little bit about the person, but has not engaged at all with our nurse navigator, who's been trying to reach for 2 years, and could have provided so much insight and help and assistance. Really passionate, great person.
Yeah. So that's such a dramatic, outrageous, absurd.
I've seen in 30 years.
Yeah, I mean that's just traumatizing when you think about the cost of that potential bill to that member. That's bankruptcy level billing, and then also to the health plan. If the health plan is going to step in and the employer is going to cover it, that's going to be a massive hit to the employer. And so hopefully that can get resolved in a way that's fair, because it's not fair. I would love for any surgeon who watches this to please let us know, how is it justifiable to bill $100,000 for a surgery that I assume took 1 day? Like, it didn't take more than
this wasn't like an outpatient. No, this wasn't outpatient. It was
this wasn't like a month-long procedure, right? I mean, this is a day. So how does anybody justify that kind of a bill for 1 day of work? I don't.
The surgeons worked for 1 day. She was in the hospital for 2, potentially 3 days, and the hospital was paid. Like I said, the surgeons are billing more than the cost of a home in the community that this person lives in.
Yeah, totally unjustifiable in my opinion. But I'd love for some surgeon out there to help us understand how this is morally okay. But the point here, Lou, is that this kind of thing can devastate an individual or a health plan, and it's all avoidable.
Yes.
But again, in my videos, and this is why I encourage any employer out there who is willing to educate your people, please reach out to me.
Yeah.
Go to allenhealthacademy.com, take a look at the curriculum, and let's get in touch, because it is possible to inform your employees on the front end so they understand why they need to stay in network. And so they understand why they need to protect the compensation that the employer has allocated toward healthcare. And the case I make for employees on this, Lou, and you know this is true, that the money that the employer allocates toward their health benefits, it's employee compensation. That is the money that belongs to the employee compensation. So when that money is squandered on medical bills that are hundreds of thousands of dollars higher than they should be, that employer has less money to give raises to the employees, less money to spend on health benefits in the next year. So that's why we have deductibles rising. That's why we have premiums going up. That's why health benefit plans are covering less and less and fewer services for the employees. So what I'm showing the employees is the why behind why we need to get engaged. It's because it's their money.
Yes.
So here this employee thinks, oh, I don't really care, my employer's paying for it, or I don't really care, the insurance company is paying for it, which I don't know what that employee is thinking, honestly. I'm sure that person is going through a ton of trauma in their own lives. But please, the videos are an hour and 15 minutes of content. Require your employees to watch them. They get a certificate of completion to verify they finished the videos. I have the data that shows, so let's say it's 100 employees in an employer group. I can provide you a report that shows which employees have finished the curriculum, which haven't. Require them to watch it. It's an hour and 15 minutes.
Yes.
And then you're possibly going to save that employee a balance bill of hundreds of thousands of dollars and a potential hit to your health plan of hundreds of thousands of dollars.
Yeah.
So it's obvious that this is a return on the investment. It's obvious that this is the right thing to do. You know, we should not be sending employees out with a blank check where they could get balance billed in return. They're going to have co-insurance in return. They have deductibles they have to pay. The employers have a responsibility to actually train their employees. And that's what I'm trying to do. So I have a scalable training solution. So again, please reach out because it's an urgent need.
Well, you know, I am in 2 weeks from today, 3 weeks, 3 weeks from today, I'm actually sponsoring the SHRM Long Island, co-sponsoring. I'm not the main sponsor. We're not in that category, but we're the Evolve sponsor, which I love because we're really trying to, you know, evolve, you know, to take employers and their members somewhere else. But what I'm planning to do is actually sponsor your course for up to 10 HR directors, HR professionals that are there that can sign up. You know, we understand as a benefit advisors how much work that you put into this. And before I heard about your courses, I was in the process of thinking I need to do this. I do videos of my own, not in the same context of yours. Yours are just done, you know, so beautifully. But you know, by the way, I went through and I can vouch for how impactful they are, even though they're 2-minute videos, which is important. You know, people's attention span is very low. So, you know, you could read the book. There's a lot of people who read out there, but having access to these videos, being able to go back to the videos, listen to them again, really from a advisor standpoint and from an employer standpoint, they are really the bread and butter that makes the members and patients understand why we're building the health plans the way we are. Right. Because the health plans that we try to customize, you know, and it's tough getting people to change what they're doing. You know, we talk about that all the time. But when you watch these videos, you understand now the approach we're taking, because most people in this path of managed care over the last 25 to 30 years have gone from a $0 to $5 copay up to a $7,000 deductible.
Right.
And that's just because they've just been riding this insurance train the whole time, just letting it be. It is what it is. They've thrown in the towel, and this is what you get by watering down your plan every year because your focus is on insurance premiums. You are, you know, passing more out-of-pocket cost and using things like HSAs and HRA strategies which have their place. I'm not against them. But when you're doing nothing to educate the member on becoming an informed healthcare consumer that has the capability of finding the best provider. Notice I didn't say cheapest. When it's life and death, you want the best provider.
Right.
That at the very least is what the American healthcare consumer deserves. When my heart or my arm or my leg or my eyesight are in jeopardy, I don't want to just go to a heart doctor, an arm doctor, and an eye doctor. I want to go to the best one. Why can't we at the very least find those people other than Google searches? I want to see the numbers behind, and we can do that now. And that's why we partially build the plans that we do. But we also don't want people to fall victim to medical bankruptcy, right? Which is the leading cause of bankruptcy in this country by far. There's nothing even close to that. And your book helps people understand how to navigate the healthcare system, how to navigate the billing issues, avoid medical debt before it's a problem. Because once it's a problem, it's a problem. You know, you don't want to discover you have clogged arteries because you avoided your preventative care. If you learn, that taking preventative measures can help you avoid a heart attack later on, isn't that a better approach? Make a little bit of an investment in time today. So, your videos, I think, we're really trying to, push this, not push it, force it. We're really trying to encourage businesses to do this, give this to your employees, incentivize them some way to do it, encourage them to do it. Believe me, the reward that you will get will be a lower healthcare spend and a healthier population, right? Less people dealing with medical debt. How many people are sitting at their desk right now at work dealing with doctor's bills and distracted by this unnecessary debt that they're going through.
Right.
If you could just share one of the most popular examples of what someone that goes on your website thanks you for. There probably isn't one specific thing, but if you had to choose just one thing that the average person would so much benefit, would benefit them so much to know in advance, what would it be?
Well, I think that one of the primary things that people come away with is the feeling of being empowered, because people really do feel helpless and they feel lost and they feel confused. And when they learn what they can do and I show them how to do it, they really feel empowered, whether they have to apply it or not. But I just had a conversation yesterday with this woman who saved $21,000 on a hernia surgery because she checked the bill. And she learned how to check the bill. She had the courage. Again, she said it took courage. She's not accustomed to pushing back against doctors and insurance companies. But she called the surgeon's office. She got clarification about it. She called the insurance company, got clarification about it. And she figured out and showed them that it was a billing error that had coded her hernia surgery as cosmetic when it should have been coded as medically necessary, not cosmetic.
Right.
Well, that reduced her medical bill by $21,000 to about $850. And this is a working class family. This saved a tremendous amount of money for this family. An indescribable amount of money. Most American families don't have more than about $500 in their bank account at any given time to pay an unexpected bill.
Right.
So, but the thing that she came away with was feeling empowered. I knew what to do. I knew how to do it. I saw other people had done it and I felt inspired by that.
Yeah.
And so I had the courage to make these calls. I was able to show them and persist because, again, at first they're going to treat you like you're the idiot. They're going to treat you like, well, you don't really know what you're talking about. So you have to push through and break through some barriers sometimes. But she was empowered. And then the other thing she said is, I couldn't believe how easy it was. It just took a few phone calls. Yeah. It wasn't difficult for her to sort this out, but it did take persistence. It took courage, and it took some know-how to do that. So anyway, that's an exciting victory story. And again, those are the things I write up in my newsletter, and I show people how to do this every day.
And you think about, what immediately when you give an example like that, I think about, 5 years ago, 10 years ago, 15 years ago, when people had very little comparable to today, much lower out of pocket cost. So these were just paid.
Yeah.
But because of the progression of the out of pocket cost increasing and being passed on to the member, now you have people who they're responsible for a significant amount of that bill now, right? And it's much harder to get blood from a stone.
Right.
And when you said the average person has $500 in, extra money, so many people are living paycheck to paycheck. When they get a bill like that, they're not writing a check.
No,
right?
That's why we have 100 million Americans with medical debt.
Yeah.
And about 1 in 6 with medical debt in collections.
Insane. And it's part of the process. It's a really tough learning curve that we've been on for a long time, but hopefully we're going to be able to break this curve. We'll be able to show businesses why this is so important. I love the and by the way, I've taken it already, but can I take it again to get my NABIP
Absolutely.
certification?
Absolutely.
We won't tell them I did it already.
Yeah. You actually have to do the NABIP version, which has the assessment. So I know, you can fast forward the videos, and just do the assessments if you want.
Well, I just renewed my license already, so I got it in 2 years. I'll do it again, but I am going back in to do these courses myself. I'm hoping to get a lot of traction for you. This is great. They're so professionally done. Anybody out there, definitely reach out to Marshall. If you're in the New York metropolitan area, if you're at the SHRM conference that's coming up in 3 weeks, stop by my booth. I'll arrange I'll sponsor this. I'm so excited about where the future is going to take us. I can't wait to see where this goes. I can't wait to see the next version of it, the chat component of what you're putting together. I think that.
Yeah, I'm excited about that too. And Lou, I appreciate your support and your enthusiasm. Thank you.
We're trying. You keep fighting the fight from your side. We'll do it here. And thanks again for being on the show today. I know we're coming up on time. I know you have a busy day. You're already getting phone calls from people that need to talk to you about their medical bills. So
probably.
Absolutely.
Have a
great day. I appreciate it. Thanks a lot. Bye-bye.